Hi, my name's Dan. Today I'm going to talk about a very quick review of cerebral vasculature with common sites for aneurysms to look out for. Start with an overview of the neck vessels. The aortic arch gives off three main branches, the first of which is the brachiocephalic branch, which breaks into the right common carotid and right subclavian arteries. The left common carotid artery is next, followed by the left subclavian. The subclavian arteries give off the vertebral arteries, which join to form the vertebral basilar system and get the posterior portion of the brain and cerebellum. The common carotid arteries bifurcate, and the internal carotid arteries go towards the anterior circulation of the brain. Start with the internal carotid artery. There are a few segments that are worth knowing to be precise and concise with dictations. First of all, there is the cervical segment, which essentially is outside of the brain, traverses from the bifurcation to the skull. The internal carotid artery then enters the carotid canal and travels through the temporal bone, specifically the petrous portion, and becomes C2, the petrous portion of the internal carotid artery, then exits the foramen lacerum and travels up and forward through the cavernous sinus near the cranial nerves 3, 4, 5, and 6. It then essentially turns straight up, goes medial to the anterior clinoid and lateral to the optic nerve. It gives off the ophthalmic artery at this point. Then it gives off this unmarked one here is anterior choroidal, and it joins with the posterior communicating artery. Finally, it bifurcates. This is the end of the internal carotid artery, bifurcates into the anterior cerebral and middle cerebral. Just a close-up view of the bifurcation of the common carotid. First of all, generally anteriorly and laterally and with branches is the external carotid. The internal carotid does not have branches outside the skull and has a carotid sinus, which is a little bit more dilated than the rest of the carotid, internal carotid, and the carotid body holds neurons for baroreceptors and things like that. Vertebral artery, pretend that the subclavian artery is coming off, giving off the vertebral artery down here. Travels, the V1 segment is preforaminal. Then the vertebral artery enters into the C6 transverse foramen, then travels up to C2, and during this time it's called the V2 or foraminal vertebral artery. It then exits, goes a little bit posteriorly, a little bit laterally, and comes back around, goes through C1, comes again posteriorly, again a little bit laterally, and then comes through foramen magnum. While it's outside of foramen magnum, it's called V3, also extradural. It then enters the dural space and goes in through the foramen magnum and becomes intradural or V4. They then join to become the basilar artery. This brings us to the circle of Willis. I'll start with the vertebral arteries that I just left off on. Essentially, vertebral arteries come and join. Before they do that, they give off the posterior inferior cerebral arteries, or picas, also the anterior spinal arteries. Once they form the basilar artery, the basilar artery has main branches of anterior inferior cerebellar arteries, or aicas. Also gives off several penetrating branches to the pons, and then finally there's essentially a basilar tip here, which is the end of the distal portion of the basilar artery, Before it does that, it gives off superior cerebellar arteries, and at the end gives off posterior cerebral arteries. So basilar tip, posterior cerebral arteries, superior cerebellar arteries. Also, pretty proximally in the posterior cerebral artery, the posterior communicating artery attaches the posterior circulation to the anterior circulation. This usually inserts somewhere towards the distal internal carotid arteries. Here and here, the internal carotid arteries are coming in from the medial portion and kind of turning outward. Their first branch is the ophthalmic artery, then the end of the internal carotid artery is noted by the branching into or the bifurcating into the middle cerebral and anterior cerebral arteries. The anterior cerebral arteries then traverse forward and medially, and where they come close to one another, there is an anterior communicating artery that connects the right and the left system. Anterior choroidal artery and lenticular striate arteries, which aren't pictured here, get the basal ganglia and deep white matter. Which brings us to a clinical point. I know when I first started looking at angiograms and basically any time I was looking at vessels, I would miss aneurysms quite often, and when I did catch them, I thought I was lucky. It turns out a strategy of looking in the most common places will get you by most of the time. A couple of those places to look. First of all is the anterior communicating artery. That's about 30% of aneurysms occur here. The next most important place to look would be the posterior communicating artery, specifically the portion of the posterior communicating artery where it comes into this distal ICA or proximal MCA. The next most important place to look is either a bifurcation or a trifurcation of the middle cerebral artery, which, depending on a person's anatomy, can split into 3 vessels or 2 vessels, depending on where the anterior temporal artery comes off. A little bit less high yield places, but certainly places that definitely need to be looked at, are the lateral carotid artery bifurcation, so where this ICA is becoming the MCA and the ACA. Also, the basilar tip, which I mentioned before, is the kind of the terminal portion of the basilar artery, and finally, posterior inferior cerebellar artery is about 3%. So now we'll go through some axial images of a CT angiogram and just get a little bit of a view of what happens in the axial plane. Okay, so here we have a CTA of the head and neck that was done for a stroke code. Essentially, they give contrast, watch the aortic arch, and trigger a bolus based on how dense the blood in the aortic arch is getting as a result of contrast administration. Here we're a little bit below the bifurcation of the arteries. I think it's important to look at things in the axial plane because that's how a lot of our images come, and it's a good thing to test out your conceptualized anatomy. So as we scroll up here, we'll see that we have, I'm going back down now, so the vertebral arteries are outside of the transverse foramina, so this is the V1 segment. As we come up, we are entering into the V2 segment, going through the transverse foramina. The vertebral arteries then travel out. This is the V3 segment. This is happening at C2 level. Now this is coming through C1, coming out a little bit again, dipping back down, and in. You can actually see right here where it's probably crossing into the dura, going from V3 to V4. At this point, these two arteries come together, right here, and become the basilar artery. Basilar artery comes up. We don't see the aicas or the picas in this patient, but here we see the superior cerebellar arteries coming in here and here. And then we traverse up and we see a little bit of an interesting normal variant in that this patient has a normal origin of the right posterior cerebral artery, but the left posterior cerebral artery comes from this posterior communicating. It's called a fetal origin here. So we don't see that. That's just a normal variant. Maybe sets them up for decreased collateralization if certain areas to go down. But here we have a nice patent posterior communicating artery, which is coming out just lateral to the sella here. And if we go back down, sorry, it just went up. If we go back down, here are the common carotid arteries. These are a little dilated at the bifurcations, but here we go. So anteriorly is the external carotid, internal carotid is here. Internal carotid takes a little bit of a tortuous course, and this is variable. Sometimes they're behind the pharynx here, and sometimes they're out further. So we come up here, and eventually they're gonna go a little bit posteriorly and enter the carotid canal, which is in the temporal bone. Then they're gonna travel through the petrous portion of the temporal bone, out of foramen lacerum, and a little bit up. Now they're in the cavernous sinus. This is where cranial nerve 5 and 3 and 4 and 6 are. So they're going through here. This would be a little bit more opacified if this was a little bit later phase. But they're coming up, coming around. Can't really see exactly where they give it off, but there's a ophthalmic artery here and here that are traveling to the eye. Following that, the internal carotid artery comes around here. Here's that prominent posterior communicating artery again. As we travel up, this is still internal carotid. Now it is bifurcated. This is the anterior cerebral artery, and this is the middle cerebral artery. Middle cerebral artery traverses laterally and then bifurcates. This is a little bit different in all patients. This patient looks like a bifurcation. So the bifurcation point is about right here. Good place to look for aneurysms. The anterior cerebral artery is coming medially here, comes pretty close to the other anterior cerebral artery. Here we have an anterior communicating artery that looks patent. So this is 30% of all aneurysms happen here, so that's an important place to look. Other important places to look are the posterior communicating artery. This is something about 20%, 10 to 15% in this area. Another 7 to 10% in the basilar tip, which this person technically kind of doesn't have, but that would be the bifurcation of the basilar artery into the posterior cerebral arteries. So that is a quick tour of the cerebral circulation and circle of Willis and spots to look for aneurysms. Thanks for listening.